Gavin Allenson with Dr. Adrian Soto, metabolism expert, medical doctor and ketone researcher here at Oxford University. And we've just been talking about some of the latest research that has come out using ketones with cardiac patients and how ketones can act as a fuel for the heart as opposed to glucose, and why ketones, why the heart prefers ketones or likes ketones.
It's again, the word prefer for a muscle, it's a weird one, but I get what you mean. It's ketones are a ready-to-use form of fuel.
Mm-hmm.
And one of the things that different heart diseases have in common is that metabolism changes when the heart is ill. And there are many different causes for heart failure. You can have heart failure because chronic hypertension or diabetes or a previous heart attack. However, one thing they have in common is that a diseased heart is not as effective for getting energy out of glucose or fatty acids. The genes and the machinery for getting energy out of the substrates in the heart changes when a heart is diseased. And
so it becomes less efficient.
It's less efficient, yeah. It simply obtains less energy from the same amount of substrates. And ketones are, as we were saying, a ready-to-use form of fuel. It's an easy to metabolize fuel. And some very, very cool studies and well-designed studies went from the wet lab, from Petri dishes, to the last one a few months ago in a critical care unit in humans, show that if you have a heart with heart failure, with heart insufficiency, and
these are real patients.
Yeah. For example, this particular study was published a few months ago, a couple of months ago, perhaps even less. And in a critical care unit with heart failure patients, with a catheter, which is a sensor and a small tube inside the heart, measuring directly the hydraulic efficiency of the heart, what they found out was that after a ketone salt infusion, the hydraulic efficiency increased. And once ketones were off, it went back to baseline. And one of the experiments of my PhD will try to look at the cellular metabolic mechanism for this already seen phenomenon. This is not the first time that this is seen, because, for example, perfused heart experiments were in vitro with a whole heart beating and measuring everything about it. We've also seen that the heart beats better or more efficiently with ketones, particularly if there was heart failure before. So we know that we already know this happens. I am focusing on why it happens. However, it just makes sense, right? I mean, it's not that ketones will absolutely cure or regenerate heart.
No.
But if you have a frail heart, if you have a heart that's coping with disease, and you remove or reduce the metabolic problem, it will simply go better.
Okay. Well, it makes sense.
Yeah.
Thank you.